will suffer from autoimmune disease. Or, as Dr. DeRosa says, it could be years of development, just like when you see your hormones going down. It could be 5, 10, 15 years, 20 years before you see the full symptoms in place of the disease, of the chronic disease that devastates many people today. See? Now, back up one more. I want to show you something else on this topic. Back up. Now, this is what just last year, a year ago, a company by the name of Dendrum developed a drug called Provenge, which is a drug immunotherapy used to treat prostate cancer patients who normally do not respond to conventional treatment, right? So they developed this drug. In the fourth quarter of this year, this drug is expected to do $400 million. They fought, lobbied to get Provenge into the marketplace, right? 6 years ago, Invita developed an auto vaccine using the body's own natural killer cells. The point I want to point out here is that this is 15-year-old technology, and you would have to expect all these steps to work properly in a cancer patient for this cell to do its job. So what we did is we developed a vaccine into about 7 to 10 billion cells using the patient's own natural killer cells to target the cancer. Because just like the bacteria or the infection rubbed its antigen along the immune system, the cancer cells do the same thing. There's similarities. Can you change the slide? Go to the next slide. So when we think of an autoimmune disease today, years ago, you always give somebody an IV antibiotic and their rheumatoid arthritis would improve for a little bit. They'd actually have less inflammation. They'd be improved for a month or two without any medication. What was that? You know, we wondered what was causing that. Today, we just look at the autoimmunity depending on what part of the body is under most attack. If we have the joints, we look at rheumatoid arthritis. Rheumatic disease, neurological complications, we looked at neuroborreliosis, MS, the nerve tissue. It could be HHV6 affecting nerve tissue. Autism. The interesting thing is I want to share this with you because I don't want to lump everything into this category, but I want to share this with you. How many people in here have heard vaccines being causative agents to autism? Okay, let me explain to you why it's more complicated than that. That sounds nice, and it has a place. But a lot of times infections are passed from mommy to baby in utero. Do you understand that? And so the child already develops with an immune-compromised state, a weakened immunity, a set-up infection in their body. Then when they go to receive their vaccine, it's another insult. It would be equivalent to the adult who had an infection in their body for many years and then developed their autoimmunity after a car accident or the birth of a child because it was a traumatic event to the body, would cause the immune system to decline and the infection and all of its co-infections to rise. Does this make sense? So stress and other things can play a factor. Immunity is very complex. Parkinson's, like symptoms, that's not necessarily Parkinson's itself, but like symptoms. And these are some of the more difficult cases because they probably have even more complexity than the technology that anyone really has available to fully help these patients. Okay, turn to the next slide. Okay, so I'm going to show you the story of how this could happen in real life in different ways, okay? You were a kid, you were back east, you were here in Flagstaff, whatever, you got bit by something. You don't even remember what it was. You didn't have a bullseye rash. You didn't have anything. Or you got this passed on by your mom when you were a kid at a young age, whatever, and you're doing well. And then one day you get into a car accident, just like I said. And then all of a sudden you're never the same. You go to the doctor, you get treated, 1 month goes by, but then within 6 months, a year, 2 years, you see such a deterioration in health, you have no idea where that came from. You understand what I'm saying? Because the complexity of the way chronic disease sets itself up in the body, you may have an exposure, it's in the body, you're handling it okay because your immune system's intact. Then you have an accident, a trauma. What can that trauma be? That trauma could be a medication, it could be an accident, like I said. It could be any kind of thing that causes the immune system to be depressed. It could be, in some patients, it could be the death of a family member. You're somebody close to you that you love, and you were doing well, and then all of a sudden, after the death of somebody, you've never been the same again. Because the immune system is very complex. We know that people have about a 75% decrease in natural killer cell function during funerals. That's how complicated. People don't get sick during final season. You know, when you look at, like, you go to school and college, everybody's got the flu during finals. Is that because there's more bacteria in the air in the finals? No, it's because your immune system is down. And I mean, it's host versus, it's the host versus the graft kind of, the host versus the virulency of the infection. Next slide. Okay, so the answer can't be just antibiotics because I told you how the biofilms block the activity of these infections. Next slide. So People need proper testing. They need to find out what their immune system is. There are simple tests that insurance companies run and that we do in our center. Very simple for us to get a quick look of what's going on in your body. We can look at your immunity, all of your different factors going on in your body, all your carcinogenic exposures. And in a quick nutshell, we understand what your risks are. Now, we want to prevent cancer. We want to prevent heart disease. We want to prevent diabetes, right? And I haven't even talked about diet because obesity plays a role. But I just want to share with you, this is a huge piece missing, huge piece ignored, huge, that is not even looked at, that causes all kinds of issues in patients long term. You know, somebody who ate well their whole life, exercised, and all of a sudden they're not aging very well. And they might be taking hormones. They're not doing very well. What's going on? They've got other issues here. Next slide. Now, in the process of treating a patient, once you find out what their infectious diseases might be, you know what their immunity is, you look at all their factors, exposures to toxins, you look at their risks for diabetes, heart disease, cancer, then you begin a process of helping them. This is a specific process we would use in the patients who have infectious disease problems. We're going to strip their biofilm, we're going to treat all their infections, and then the goal is to reestablish the immune function. And this is a process. It's not an overnight fix. But I can share with you what we do in 8 weeks. I have not seen any other clinic that I know does in 2 or 3 years of treating their patients. That does not mean we help everybody, but we do help a lot of our patients because we are dealing with a very complex illness. And it's fair to say any doctor in any situation you're really asked to tackle a bear here because these are people that have been thrown out by the medical community. They've been sent home. No one else can help them. And then they arrive at our office. But the rest of you, before you come down this road, you can take care of it. In fact, if you know what you're doing and keep your immune system strong and all the other factors in place, you can prevent this. And you can live a long and healthy life if you know, like Dr. DeRosa said, if you know what you're dealing with. You can do all those little things along the way to prevent, protect, and help your body. Next slide. So I'm going to do a little bit of the diet. Forget the food pyramid. Get rid of everything you've been told about diet. It's nonsense. I've spent years looking at diets, and the biggest problem is people do not follow them. 95% of all diets fail, and the reason is because they don't stick to them, and the other reason is because food is emotional. You understand? And probably for a number of reasons, food is emotional. So here's what I'm going to share with you, what the food pyramid should look like. It's very simple. Everything you eat needs to be organic as much as possible. And the water you drink better be clean. And it's full of hormones. And Dr. DeRosa wasn't speaking lightly. I will confirm to you that men and women are having both breast cancers and prostate cancers